Time to check in on the COVID-19 situation in the province from someone fighting it on the front line. Dr. Kevin Wasko is the physician executive for integrated rural health for the Saskatchewan Health Authority based in Swift Current. I know you're very busy. Thanks for being here.
Thank you. Nice to be here.
First off, we know hospitalizations are creeping back up and earlier than they did last summer. What can you tell me about people coming into hospital with COVID-19 right now?
So predominantly the people that we're seeing hospitalized are those who have not been vaccinated. It is a younger population that is infected in the province with COVID, but they're not the people that tend to be making up most of the hospitalizations, although there are some in hospital that are younger, including admissions to the Children's Hospital in Saskatoon. But for the most part, it's older individuals and those who were not vaccinated.
I know this isn't your decision, but I'm wondering if you think it's helpful for the government to share that about 3/4 of people in hospital in province right now are unvaccinated. It doesn't seem to be increasing vaccination numbers by any massive measure, and I'm wondering what message that information sends to the public.
Well, first of all, it is the truth. Most of the people in hospital are people who have opted not to be vaccinated because anyone over 12 has been eligible for a very long time. However, it also needs to be known that even if you are vaccinated, it isn't 100% guarantee that you won't get COVID and that you won't get sick. It decreases your likelihood by a great amount, and it is the right thing to do. But it's still important to be careful and that it doesn't make you invincible. And I think that by hearing that most people are in hospital are vaccinated, it may send the message that those who are vaccinated don't need to worry. And that's not necessarily the case.
You work in rural health. We know there are some pockets of vaccine hesitancy in the southeast and the southwest. What are you hearing from people who don't want the vaccine?
I think that there's a whole array of reasons out there why people are choosing not to be vaccinated. There is some skepticism about the vaccine. There's definitely some misinformation or the perception that if you're young and healthy, you're not going to get sick anyway, so it's not really a need. And then there is definitely a contingent of people who have really bought into that anti-COVID, anti-mask, anti-vaccine, story or narrative, and that is a reason, and it is out there, and it is alive and well, unfortunately.
We're heading toward fall, back to school, people going back indoors, and this inevitable fourth wave. What is the impact of all of this on your colleagues after the last year and a half?
Well, I think what's different now than was the case early on in the pandemic is that people are tired, people are burnt out. There are people who have left the system, whether it's because they decided this isn't the profession for them, or they've opted to retire because they were eligible to do so. And what it's caused is a very real labor shortage across not just the province, but the country. We're feeling it in rural Saskatchewan, but we're also feeling it in our urban centers. The emergency department at RUH, for instance, has had an exodus of nursing staff, and it's really placed a strain on the services there. But in rural Saskatchewan, we're having to put hospitals on diversion because we can't staff the facilities with nurses or physicians because people are tired and they're not wanting to work overtime and put in that extra time when they've had such a long go of it over the past year and a half.
And this just isn't a COVID issue. This is a general, regular health issues issue.
Yeah, at this point in time, we barely have the staff to meet the needs of the people that we serve. And if we were to have a fourth wave come fall, it would look very different than what that looked like previously in the pandemic, because we don't have the capacity anymore to surge like we did. We don't have the human resources to support it. And that will impact not just those who are presenting with COVID, but those presenting with any illness to our emergency departments across the province.
How do we then, as a collective, minimize the impact of a fourth wave? What do you, as a physician fighting this, think needs to happen?
I guess I'm at a loss of how we convince more people to get vaccinated. Our province has the worst rate in the whole country. We need people to take up the opportunity to get immunized. It really is the real hope to not have a fourth wave, but it has to happen pretty quickly, to be honest. In addition to that, just because public health orders have been lifted doesn't mean that those same measures that were in place can't be practiced by people if they choose to do so. So for instance, masking when indoors or attending large indoor gatherings where you're in close proximity to people, remembering to wash your hands, stay home when you're sick, all of those basic things that have been emphasized throughout the pandemic still apply and still need to happen.
Thank you so much for your time today, Dr. Wasko.
Thank you.
Dr. Kevin Wasko is the Physician Executive for Integrated Rural Health for the SHA, based in Swift Current.